Okay, let's go over documentation and notes, which is going to be fairly easy um, and self-explanatory. So I'm going to find my patient, go to recent access and go to the correct encounter. And then simply I'm going to go down to the document tab. And I can see here that I already have a note in draft status. I haven't signed that. But I want to enter a new note. So I click down here. You see I have four choices. Pediatric admission note, a discharge summary, an ED note, which you won't be doing, and a progress note. Let's go ahead and do a admission note. Okay, so you can see there's 5 tabs up here. The first tab is past medical history, um, and a home phone number pre-populates from registration, so that's kind of cool. Primary care provider, as you can see here, is starred, so that's required. So you'll have to click here and enter the primary care provider's name, Dr. Standiford, and you can get their phone number too. Historian, put that in there. Chief complaint. Now HPI. This is going to be pretty verbose and important. So 5 days, or you'd probably want to put the name in. Eric has a past medical history of asthma, who presents with 5 days of blah blah blah. I'm not going to teach you how to write a note, okay? But this is going to be pretty important. The attendings are going to read this stuff, so I would do it pretty good there. Past medical history. You could put no past medical history, no recent admission, hospitalization, or you can put asthma and further sort of describe their asthma down in the comments. Um, Mild, intermittent, or you can put some of that information too after you've done this. You can further describe their asthma. No intubations. I don't know how to type. No intubations, no hospitalizations, or 4 hospitalizations, whatever. Again, I'm not going to tell you how to do a note. This is pretty self-explanatory stuff. Pneumonia, otitis media. Past surgical history, no prior surgery. Immunizations, up to date or other is not. Um, Social history, all this stuff is pretty important to put. Most of the time, I guess it's going to be lives with family. Um, that's the living situation, smoke exposure, secondhand, cigarettes, marijuana. And then there's kind of a cool section, heads assessment for adolescents, where you can free text in each of those sections. Family history, you can write non-contributory. Don't forget to ask about childhood illnesses and families that may be relevant. Developmental history, diet. And then you can kind of come down here and review home medications that were done pre-populated from the medication reconciliation that the nurses should do. And then allergies down here pre-populates. Review of systems. This is pretty important. You can now, if I hit the left mouse button, it will circle it, and the patient had a fever. If I hit the right mouse button, it crosses it out. So there hasn't been any weight gain or no weakness. No discharge from the eyes, or you can say that they were all negative if you asked about all of those categories. Please do a good review of systems. Um, if you've asked about all these things, there hasn't been hives, there hasn't been this. Okay, next section, physical exam. Vital signs should pre-populate up here. Weight, height. Don't be afraid to put in your own vital signs. If you've done a resting heart rate was 100, your respiratory rate that you got was 40, but it should also pre-populate there. Pulse ox interpretation, normal or abnormal, oxygen given. You could put nasal cannula. Physical exam. So, you can choose any of these. If I hit this N, normal, it circles the blue normal ones, or it circles the blue ones anyway. Again, this is where you can circle it with the left click or right click down here. And, be careful with this, but this is pretty important. You can also hit other and type in extra comments. Eyes, if they were normal, you can choose those. Conjunctiva wasn't red. Nose, normal. Respiratory exam. Again, you can circle these, but if the patient's coming in with a respiratory problem, I'd be pretty careful with this. Decrease breath sounds, right? And then it will have other options here. You know, basically choose all the categories that you've examined. Obviously, we think the physical exam is pretty important. And then other down here, when I do notes, I'll usually put, really important things. Well hydrated, brisk cap refill, clear auscultation bilaterally, no wheezing, abdomen soft and non-tender. Or, of course, if there are abnormal findings, I'll describe them well down here. This is kind of cool, body images for rashes or, more kind of things. You can use this head. If the patient had a rash or a bruise there, you can circle that and describe that. Results. So this should be pre-populated laboratory data from the last day or two. Imaging should pre-populate. Shouldn't have to do anything there. And then assessment and plan. Overall clinical impression. Now this is free text. We kind of wanted it this way. We want what your assessment and plan are. Pretty thought out here. Not just, pneumonia. We think the patient, or you think the patient has pneumonia because X, Y, and Z. Other things on the differential include bronchiolitis, but this is less likely because of X, Y, and Z. And again, the attendings are going to read this and, pretty much decide if you're a good resident or not, just solely based on this, nothing else. No, I'm just kidding. Okay, diagnoses. This is required. When I hit this, some previous diagnoses are going to be shown here. You can check any of those, asthma, or you can add problems, things like bronchiolitis or pneumonia or dehydration. Every problem or diagnosis they have, put it here. That includes hyponatremia or hypokalemia. That's pretty important for documentation and eventually billing as well. Okay, so when you're done with your note, you're going to go ahead and hit save. And now this is important. You're going to want to add on the attending who is going to review this note and co-sign this note. Now, the way you do that is you hit add provider and you search for your attending. Boom, there's Dr. Chinsky. Okay, or me, or Dr. Burke or Dr. Hofer. Okay, you're going to choose the attending. Boom. Hit OK. Now that will go queue to that attending. And then when you can save it as draft if the vital signs haven't been pre-populated, but eventually you're going to definitely want to sign it and hit save. Now, important point, the attending that you're going to sign it to may not be the attending that's covering that night. Ask yourself who is going to be the attending that actually sees the patient in the morning or during the day. This is important for Sundays. Sometimes I'll be covering Sunday night, but Dr. Chinsky will come in the morning. So you should know that. You could always call us, ask your senior, but don't be afraid to call us for clarification because we want it to go to the right person. Okay, so signed. It has some required fields. It says complete required questions. I actually didn't do a diagnosis, so let me pick a diagnosis. Asthma. Present on admission, yes. And then you can have an assessment plan for that. Improve if you, space to Q4 hours prior to discharge. But the meat of the assessment plan is going to be up here in the overall clinical impression. So what else did I forget to do? Immunizations and family history I have to do. So let me pick that. So immunizations, up to date, and family history is type in. So I'll just say non-contributory if it really is not contributory. Okay, so save, sign, and I'll put my pin in. Okay, so there, boom, that's an admission note. Progress note, pretty much very similar. I'm not going to go through this in detail. Subjective, physical exam results. Again, things should pre-populate. And discharge summary, again, fairly self-explanatory. Just take a look at it carefully, especially if it's the first couple of times you're doing this.